Um, Miss Pascasio, I have a little story to tell. For the last couple of years, every time I went to my doctor, I'm like, Doctor, are you sure I don't have thyroids? Because I knew my grandfather had it, my mother had it, and I would Google different things, and I think my thyroids are acting up. So for the last 2 years, I didn't ask him anything. But when I went there this year, he said, you know what, Sandra, I'm going to have to send you for further tests because it seems you have a nodule and it's bigger than normal. So I said, okay. But there was some sort of reassurance because I said to myself, you know what? If this is a problem, I am living in the correct place. Mm-hmm. Because this is America and I have a great doctor. I have the health insurance that will take care of me. So I was not worried. But I thought to myself, thank God I'm not in Belize. So now the question is, if someone is in Belize and they are detected with something, what can they do? Where can they go?
Well, it's a matter of what they're detected with. If we're talking about cancer, and if we focus on women with breast cancer, they've come a long way in 5 years. Okay. Now there's a treatment center in Belize. We are. If you look at the continuum of cancer care, we are kind of at the back end. We are looking at improving the front end. So mm-hmm. if I go to my doctor and because I feel a lump that was not there when I did mm-hmm. my last self-breast examination, my doctor can say, okay, well, we need to biopsy that. Mm-hmm. So they would take a biopsy of that, and they would send the specimen for pathological examination. And if it comes back that this is in fact suspicious, then they can refer the patient by consultation to the cancer center. Okay. There are some, there used to be the fact that the only answer used to be surgery, but there are lots of alternate approaches to managing breast cancer right now. And what we try to do at the center is give the patients the choice. Okay. Once a patient is informed, they can make a decision about what avenue they want to take. Exactly. But in Belize now, we provide chemotherapy, and it's not restricted to a few drugs. We provide a very large, wide range of chemotherapeutic agents that the oncologist actually gets from, and they're by U.S. standards. We use U.S. manufacturers for this. Like I told you before, one of the things that we did not anticipate was we did not anticipate the treatment of children. Okay. Yeah. And the children in Belize, for some reason, they were being treated generously by a physician in Merida, Dr. Pablo Gonzalez, who did it out of the goodness of his heart. Wow. But there was really no resources within the Ministry of Health to manage these children. So the children we never saw. They went to Mexico or to Merida. Okay. Now we have an arrangement where he will first see the children, and once the children are stable, they send them down to us, and we continue with their treatment. Mm-hmm. I can't tell you what a tremendous burden this takes off the family.
Yeah, it does.
Because when you have a little one, to take an 8-hour bus ride, I know, to Merida, and then to stay there for 6 weeks, which it disconnects the family entirely. And we're not talking about people that are wealthy. We're talking about people that live one banana at a time. Yeah. Right? So for the children, the arrangement, and it was purely because there was nothing else to do. And we agreed that he will manage them if they're in trouble. Okay. He will provide guidance to the cancer center on how to manage the complications. And it's been a wonderful arrangement for us. Okay. He actually, in May, at our clinical conference, he came down. Oh, nice. And he met some of the children that he actually saved. Wow. And it was a beautiful reunion. He cried, they cried, everybody cried. I can imagine. But he still does it. Okay. And he does it because he cares about the children. And for the Ministry of Health, I believe that they're moving forward with certain arrangements to make it easier for the children to get treatment because we don't have the capability of initially treating them in Belize.
Okay, thank you. Well, bless his heart for being so generous. Folks, we'll be right back.